Can a shampoo grow your hair? What are the best shampoos for healthy hair growth? That is the topic of today's video. Now, to be clear, shampoo is not going to turn you into Rapunzel. It's not going to affect the hair growth cycle in a meaningful way. However, there are medicated shampoos on the market which have active ingredients in them that address some of the underlying issues that lead to miniaturization of the hair follicle. What do I mean by that? Well, a really common type of hair loss that affects both men and women is androgenic alopecia. It's called androgenic because there's a genetic component to it, and it also involves the androgen hormones, which both men and women have, and their impacts on our hair follicles. Some people's hair follicles are very sensitive to these androgen hormones, and with time, the hair follicles miniaturize and they turn into a little baby vellus hair. And that starts to become obvious over time. Women will notice that their ponytail is not as thick, and they'll start to observe that their central part is widening. Men start noticing that their hairline is receding. Androgenic alopecia is a progressive and chronic hair loss disorder. There is no cure for it, but there are certain things that you can do, certain treatments and modalities and lifestyle habits that can have an impact ultimately on the rate of hair loss, can also help to convert those vellus miniaturized hairs back into a terminal hair. Here's the good thing about androgenic alopecia, the silver lining, if you will. If you're going to have a hair loss disorder, this is actually one of the types of hair loss that is better to have because it is non-scarring. There are other hair loss disorders out there that as they progress, they scar the follicle. And once that scar forms, hair will never grow out of that follicle ever again. The good thing about androgenic alopecia is that those miniaturized vellus hairs can be restored into terminal hair. So you do have the opportunity to get some regrowth. Now, it's not going to stop the process. It's not going to take you back to where your hair was many years ago in your younger years, because this tends to start anywhere from late adolescence to middle age. It's not going to give you thick, voluminous hair, but you can get regrowth to a point where you start noticing that some of that more obvious scalp exposure is filling in with more hairs. Now, on my channel, I have a lot of videos about androgenic alopecia and confirmed effective treatment modalities. The gold standard is minoxidil, a topical, but it also can be taken by mouth to get regrowth. Then you also have oral medications that impact the hormones: finasteride, dutasteride, spironolactone, which is used in women with androgenic alopecia. And of course, one of my favorite modalities to pair with these things is low-level laser therapy. But you came into this video to hear about shampoos that can help you out. Yes, there are some medicated shampoos out there. When used alongside established treatments, can overall support better results. Now, before we get into the shampoos, as a reminder, shampoo, it is a scalp-directed product. I always want to remind you guys that because a lot of people end up spending most of their lathering time on their strands. Shampoo is meant to be lathered to the scalp, and especially here, the active ingredients, you need to lather them to the scalp, not to your strands. The shampoos I'm going to be talking about in today's video actually can end up being kind of drying on your hair strands and leave them more prone to breakage, more prone to tangling, unmanageability. So when you use these shampoos, after you rinse them out of your scalp, make sure to follow with a conditioner. How often do you need to use these shampoos? The frequency will depend on the shampoo and also will depend on you and your hair type. Certain hair types don't tolerate daily shampooing, so you'll have to modify depending on the frequency with which your hair type tolerates shampooing. The first shampoo is actually zinc pyrithione. Yes, an anti-dandruff shampoo. You'll find zinc pyrithione in Head & Shoulders shampoo, and the way this ingredient ends up working out for dandruff is it has an antifungal property to it. It reduces the burden of Malassezia yeast on the scalp, and those Malassezia yeast play a key role in dandruff, but they also can generate a lot of inflammation in the scalp, and that inflammation can create an environment in your scalp that favors the miniaturization process. So by using a zinc pyrithione anti-dandruff shampoo, you can support better scalp health, and ultimately that may help in getting you better results from your androgenic alopecia treatments. This has been observed clinically as well as in studies that patients who use a zinc pyrithione anti-dandruff shampoo do show an improvement in hair growth and thickness and density. How often do you need to use a zinc pyrithione anti-dandruff shampoo to derive the benefits for scalp health for your hair regrowth journey? 2 to 4 times a week. Now, as I said at the beginning of the video, not everyone tolerates shampooing their hair that that frequently. So if you only shampoo your hair once a week, then you use it once a week. The goal isn't to be perfect, but to at least derive some of the benefits from the ingredients, but also supporting scalp health. The second shampoo, which I actually have a whole dedicated video on for androgenic alopecia, but it's definitely worth bringing up again because it is one of the more evidence-based options out there, is a medicated shampoo with the antifungal ingredient ketoconazole. Now, ketoconazole shampoo is a prescription at 2% strength, but you can actually buy it over the counter without a prescription at 1% strength, sold under the brand name Nizoral shampoo, and this likewise can be effective. How might Nizoral ketoconazole shampoo help with hair growth? How is an antifungal here helping? Well, again, that antifungal may help reduce the burden of the yeast on the scalp that can create some inflammation. But more specific to androgenic alopecia, ketoconazole has anti-androgen properties. Specifically, it can inhibit an enzyme called 5-alpha reductase. What does that mean for your scalp and your scalp health? Well, 5-alpha reductase is an enzyme that takes the androgen hormone, testosterone, and converts it to something called dihydrotestosterone. Dihydrotestosterone is a very potent form of androgen, and it is what is responsible for driving the hair miniaturization process. Some of the medications that we use to treat androgenic alopecia specifically work by inhibiting that enzyme. Applying something to the scalp that could inhibit that enzyme just in the scalp, that's very desirable for slowing down the miniaturization process and potentially getting you some regrowth. This has been examined in clinical studies, and in fact, patients who use ketoconazole shampoo get better results from their minoxidil than those who do not. So it's definitely worth trying to incorporate into your routine on the scalp. How often do you need to use ketoconazole shampoo? 2 to 4 times, but again, if you're someone who can only shampoo the scalp once a week. Now, a word of warning, Nizoral can be very drying. Some hair types do not tolerate it at all, so just be aware of that. I happen to really like using it. I find the drying effect actually helps with a little bit of volume because I have fine hair and an oily scalp, so my hair can very easily become weighed down and look very greasy. So I actually like that. But depending on your hair type, that may be a complete no-go. Third shampoo may come as a surprise to you because it's one that we don't really talk about too often. It is a shampoo called Alpecin. This is a caffeine shampoo. Now, caffeine isn't just for coffee and energy drinks. It's commonly found in skincare and hair care products. Why? Well, caffeine is an antioxidant when applied to the skin and when applied to the scalp, for example. Antioxidants help to reduce the burden of oxidative stress, generates inflammation, and can tip the balance over in our scalp to miniaturization. The thing about caffeine for your scalp specifically is that it actually, in contrast to other ingredients that you might encounter in hair growth promoting products, it is well established to localize in the hair follicle quite efficiently. Not only does it localize there, but it can remain there, so you have a depot effect. Not only do you derive potentially an antioxidant effect from topical caffeine, but caffeine can inhibit another enzyme called phosphodiesterase. Different from 5-alpha reductase, phosphodiesterase is an enzyme, and by inhibiting that enzyme, what ends up happening for your hair follicle cells ends up being a really good thing for them. It leads to an increase in something called cyclic AMP, which is an essential mediator for healthy cell metabolism. So by utilizing a caffeine-containing topical shampoo, you actually can get an improvement in hair follicle cell metabolism, energy, ultimately favoring restoration of hair growth, converting that vellus hair into a terminal hair. So that's another way in which it's thought to work. I'm mentioning this Alpecin shampoo specifically. I'm not sponsored by them, but their shampoo was actually utilized in a clinical study looking at the effects of a caffeine-containing shampoo. How often do you need to use this caffeine-containing shampoo then? Well, the clinical study of Alpecin, they were using it once a day. So again, if you can't shampoo your scalp once a day, does that mean it's not going to work? You shouldn't bother with it? No. But if you are somebody who shampoos daily and you tolerate using this particular shampoo daily, try using it daily for maximum benefit. Those are the 3 shampoos with active ingredients in them that have been clinically tested been shown to help with hair regrowth. Set your expectations. These things alone are not going to be enough for you to get significant results. Think of these shampoos as playing a supporting role in getting maximum benefit from whatever hair loss treatment you are pursuing, if you are pursuing one. Now, if you're not interested in any sort of hair loss treatment, will these things help you out? They might. Setting your expectations is key. I would say if you're somebody who has already invested your time and energy and money into things like low-level laser therapy, you're using minoxidil, maybe you're even taking medications, why not sprinkle one of these in? Because it may get you even better results from those. And if you tolerate these shampoos, any one of them, then why not? You know, why not? Now, when it comes to the hair loss process, scalp health is something that gets thrown around a lot, that terminology, scalp health. Keep in mind that in order to support healthy scalp health, you do need to have some shampooing of the scalp at some regular interval, depending on how your hair type tolerates that, because it's really important for removing oil, dirt, product buildup, all of those things. If that's left behind on the scalp, it can create a lot of scalp inflammation. For patients who have dandruff, we really encourage them to shampoo their scalp as frequently as their hair tolerates to remove that oily buildup that can be actually quite inflammatory. And in the case of androgenic alopecia, you don't want that excess inflammation, scalp irritation. It may favor miniaturization. So regardless of these shampoos, shampooing the scalp regularly is very important for androgenic alopecia. The other thing that is worth mentioning is simply the act of massage. Now, I have a video that I recently went over the clinical studies showing benefit of scalp massage for hair regrowth. So when you use your shampoo, really take the time to massage it in. You don't need a large volume of shampoo. If anything, that can become tricky because you may not rinse it all out. You may leave shampoo residue behind on the scalp that's drying and irritating. So make sure you rinse it all out, but take the time to really massage the scalp with the shampoo. Get that lather to all surfaces of the scalp. The massaging action helps with blood flow, and it helps bring in healthy growth factors. And ideally, you're going to get even better results if you take the time to really massage it in. You don't need to do it aggressively. You might want to use a shampoo brush. I personally have enjoyed using those myself. A shampoo brush not only helps distribute the shampoo, but it has those little fingers that offer a massaging action. Which of these three medicated shampoos works the best? Like, if you're going to pick one, which one is the best? I wish I could answer that. We don't have comparison studies out there. Can you use more than one of these shampoos? Yes. You could alternate using one on one day and another on the other day. Alternating these shampoos is also an option. I'm somebody who usually has, at any given time, 2 or 3 shampoos in rotation because I'm just like that. But when it comes to medicated shampoos, we do find that a lot of patients don't get results from using just one ingredient. They get better results, or they respond at least, when they alternate certain active ingredients. That's true for dandruff, that's true for psoriasis, and it's true for androgenic alopecia. My other tip for your scalp health journey, if you will, for just helping overall to support your hair growth, is to avoid wearing really tight hairstyles, tight braids. If you do wear tighter braids, make sure that you switch up the direction of the braids. Take a break from them from time to time to give your scalp a little breathing room, because tight hairstyles, tight ponytails, slick back buns, hair extensions puts a lot of tension on the hairs, and a lot of traction, quite literally, on your scalp can be very inflammatory. And it can actually cause, in and of itself, a type of hair loss called traction alopecia. Not only is it hard on your scalp, but it's hard on your hair follicles. Over time, you'll experience a lot of breakage, hair loss in the areas where you have traction. And over time, that chronic traction actually can lead to, unfortunately, scarring hair loss. And remember what I said at the beginning of the video. For scarring hair loss, once that scar forms in the follicle, you can't get regrowth. So you want to avoid that. All right, guys, so those are my 3 shampoo recommendations to consider for hair growth. This video was helpful in explaining how these ingredients work, what you might expect from them. Recently, I did a little YouTube short on these shampoos. So if you caught that and you had a lot of questions, hopefully I addressed more of them here in this longer video format. Thank you so much for watching to the end. I greatly appreciate it. On the end slide, I'm going to put my recent video on the benefits of scalp massage for hair regrowth. Check that one out next. It's definitely definitely worth watching so you can learn more about how to support your scalp health. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!